Okay, so continuing with the war on welfare with Reagan. So Reagan promised national renewal and went in a new direction of dismantling the welfare state. He believed welfare recipients were cheats and freeloaders who needed to be working. Reagan did not understand systemic oppression or meager earnings. He wanted to remove the responsibility of the needy from federal bureaucracy and have it returned to private institutions and organizations. Um, his economic program resulted in the nation being in the worst recession since the Great Depression. Millions of people who had never before been below the poverty line now found themselves there. So he terminated programs for unemployment, cut spending to AFDC, childcare, school lunch, food stamps, subsidized housing, and many more programs. Now, when Bush came into office, he ignored domestic problems, leading to more homelessness, unemployment, child abuse, and discrimination. He did pass the Americans with Disabilities Act for deserving people and increased minimum wage. Bush relied on private sectors to help the needy. So he ignored domestic problems, resulting in states freezing or reducing AFDC benefits. Um, he did, though, pass the Americans with Disabilities Act and increase the minimum wage. So Clinton reversed decades of federal social policy with the PRWOR Act, which was the Personal Responsibility and Work Opportunity Reconciliation Act. It replaced the AFDC with the Temporary Assistance for Needy Families grant, the TAMP. That allowed states to establish the eligibility rules, but was required to end in that help after 2 years, whether the individual had found a job or not. And it also set a lifetime limit of 5 years of assistance, and immigrants who were not citizens could not receive food stamps or SSI. And it let the states decide if they could continue or wanted to continue their Medicaid payments. So Obama, so he increases funding for the SNAP, the Supplemental Nutrition Assistance Program, for food banks, for the WIC program, for the Neighborhood Stabilization Funds, for the Homelessness Prevention Funds, for the Community Services Block Grant, the Weatherization Assistance Program, the Workforce Investment System, unemployment insurance, Social Security, Supplemental Security Income, and the TAMF program. He also created the Affordable Care Act, providing affordable health care for everyone. So Trump doubled the child tax credit from 1,000 to 2,000 per child and expanded the eligibility for it. He increased the child care and developmental block grants, expanding access to quality, affordable child care for more than 800,000 low-income families. He expanded apprenticeships, creating the Pledge to America's Workers, providing more than 16 million job and training opportunities. So far, Biden, he has had a 15% increase in SNAP benefits. The American Rescue Plan, he created that, which provided immediate relief to American families and communities. And then the American Families Plan extended key tax cuts that benefit lower and middle income workers and families, including the child tax credit, the earned income tax credit, and the child independent care tax credit. It will also extend health insurance tax credits, lowering health insurance costs. So services. Let me make sure I didn't miss anything. No. Okay. Services. Oh, here we go. So, Health and Human Services Commission, this includes welfare offices, and the welfare offices, help provide information for SNAP, TAMP, and other social services. Um, they also help with childcare, food assistance, cash for needy families, and burial assistance. So I have my local office and phone number and address listed here. But the website, if you go to the website, you can put in which state you're in, and you can search for it, and you can find local offices. I also included the Comal County Assistance Program. I really like this website, which is right here. You can get national programs coming up. You can get local programs coming up. You can get church programs, food pantries. It provided all kinds of information. I just listed a few that I found. So it lists the Community Resource and Recreation Center, and they assist with electric, water, propane, pharmacy, or rent expenses. Salvation Army, they help to pay utility bills, rent, housing expenses, food, and disaster relief. The Community Council of South Central Texas, they have referrals for rent and housing assistance programs, energy bills, free food pantries, and other government assistance. And then the SOS and the Kitchen Table are both local food pantries, and I have all the numbers provided there. I also listed the Family Life Center. So it is a nonprofit that has funds for mortgages, rental arrears, gasoline vouchers, energy bills. But they do focus on short-term support for residents that have like an emergency situation. I have provided their information here as well. So interventions. I think for micro, the first priority is meeting basic needs. So, Maslow's hierarchy of needs, focusing on physiological needs of food, clothing, shelter, sleep. Then recognizing the service delivery gaps and educating ourselves on what assistance programs are available to fill those gaps, along with the eligibility requirements to help assist your clients. You don't want to recommend programs that they're not actually eligible for. Meso interventions. So I think mainly community awareness, available through resources and services, being aware of local community stakeholders, opportunities for funding and collaboration, forming or joining coalitions, creating task groups, organizing public workshops or social media campaigns focused on awareness. And then for macro, I think advocacy. So through the micro interventions, service delivery gaps will be recognized, whether it's availability or accessibility, whatever the gaps, social workers can then advocate filling those gaps through either policy or legislation. So I went ahead and included the scope of poverty after COVID. I think it's kind of important to address. So at the end of 2020, the US economy had 9 million fewer jobs than at the end of 2019. 12% of people, compared to 9% before the pandemic, responded to the 2020 census reporting that they either sometimes or often did not have enough to eat in the past week. 1/5 of renters reported that they were behind on their rent. The Urban Institute is projecting that the overall 2021 poverty rate will be 13.7%, which means that 1 in 7 Americans may fall below the poverty threshold. Legislation was passed in December of 2020 providing direct aid for U.S. families, including another round of stimulus checks, extended unemployment benefits, and enhanced SNAP benefits. I am not sure if that is going to be enough. So my conclusion, using cultural humility, social workers need to continue helping clients meet their basic needs in dealing with depression, anxiety, medical needs, or behavioral health needs. Social workers now may need to help with any transitions or crisis that clients may be dealing with due to COVID-19, including financial needs, access to healthcare online. People in poverty have trouble having access to computers or, the internet. We may have to help people locate additional resources and help clients understand the information just surrounding COVID. I think we will continue to see negative effects due to COVID, including a continuation of, economic devastation issues, which can lead to child neglect, spikes in mental health crisis, more drug overdoses, substance abuse, and domestic violence and child abuse. I think social workers, once again, will need to step up and advocate for better policies to help eradicate all the inequalities leading to poverty. Thank you.